Imagine a world where millions of men silently question themselves, comparing, doubting, and chasing an idea shaped not by science but by insecurity and myth. They scroll through advertisements that promise miracles, watch influencers talk about secret formulas, and wonder, is something wrong with me? Today, we're going to uncover the truth behind one of the most misunderstood topics in men's health, a topic whispered about but rarely explained with facts. This isn't about selling hope in a bottle or offering illusions of instant change. This is about real science, real evidence, and real confidence. Because when we understand how our bodies truly work and what really influences growth, health, and performance, we stop being victims of misinformation and start being masters of self-awareness. In this session, a urologist breaks down what research actually says about penile length, what determines it, what affects it, what's myth, and what truly matters. And perhaps most importantly, you'll learn what scientists quietly know but seldom emphasize, that satisfaction, confidence, and health come from much more than numbers. So stay with me till the end, because by the time this talk finishes, your entire perspective on this subject and maybe even how you see yourself will change forever. Penile length, like many other physical attributes in the human body, is largely determined by genetic inheritance. Every aspect of human growth and development, from the color of one's eyes to the structure of bones, is influenced by the complex interaction between genes and hormones. In the same way, the length and shape of the penis are coded within the DNA that each individual receives from his parents. This genetic information dictates how the body's tissues respond to hormones, how rapidly cells multiply during development, and even how the body allocates resources during puberty. Scientists have conducted multiple studies across diverse populations to understand why some men have longer or shorter penile sizes, and all reliable research points toward the fact that genetics is the primary driver, with environmental factors playing only a minor role. Human growth is orchestrated by a symphony of genes. In the case of penile development, certain genes regulate the formation of reproductive organs even before birth. During fetal life, the Y chromosome carries the SRY gene, sex-determining region Y, which initiates the development of male reproductive anatomy. This includes the formation of the testes, which later produce testosterone. The sensitivity of the body's cells to this testosterone is controlled by another set of genes known as androgen receptor genes. Variations in these genes can make tissues more or less responsive to testosterone. A highly sensitive receptor can enhance growth during the critical developmental stages, whereas a less sensitive receptor may limit that response. Thus, two individuals with the same testosterone levels can have different outcomes, SI, imply due to genetic variations in how their bodies interpret those signals. Scientific data suggests that about 7,080% of the variation in penile length among men can be attributed to hereditary factors. The remaining 2030 may be influenced by nutrition, general health, or hormonal balance during puberty. However, even these external influences are usually constrained by genetic limits, meaning that genetics provides the blueprint and environment only slightly modifies the final outcome. For instance, a boy suffering from malnutrition or a hormonal disorder during childhood might not reach his genetically predetermined potential, but even optimal nutrition will not extend growth beyond what the genes allow. In medical research, one of the largest studies on penile length was published in the British Journal of Urology International, BJUI, involving more than 15,000 men worldwide. The average erect penile length was found to be around 13.12 centimeters, about 5.16 inches, while the average flaccid length was approximately 9.116 centimeters, 3.6 inches. The range of normal was quite broad, and this spread is what scientists call natural variation. This variation is a universal principle of biology. In the same way that not everyone grows to the same height or develops the same hair texture, not every man will have the same penile length. The concept of normal, therefore, does not mean identical. It means falling within a statistically expected range determined by evolution and genetics. When people compare themselves to unrealistic standards, often shaped by media, adult films, or misinformation, they misunderstand what average truly means. A man may perceive himself as small even when he is within the normal genetic variation. This misperception can lead to unnecessary anxiety or low self-esteem. The scientific perspective, however, clearly demonstrates that the body follows its own genetic programming and that normal variation is not only expected but essential for genetic diversity. Penile development begins in the embryonic stage long before birth. Around the 8th week of gestation, under the influence of testosterone produced by the fetal testes, the genital tubercle elongates and forms what will become the penis. The degree of elongation at this stage is crucial, and once again, it is the genes that regulate how the tissues respond to hormonal signals. Some rare genetic conditions, such as androgen insensitivity syndrome or 5-alpha reductase deficiency, can alter how the body uses testosterone, resulting in atypical development. These examples further confirm that the blueprint for penile size lies in the genetic and hormonal system, not in external factors later in life. During puberty, the hypothalamic pituitary gonadal axis, a hormonal control system in the brain and testes, becomes active. This triggers a surge in testosterone, which stimulates the growth of the penis, scrotum, and other secondary sexual characteristics. But even here, genetics defines the response. Venus of tissues to these hormones. If the androgen receptor genes in a particular individual have variations that make the receptors less active, growth may be more modest. Conversely, in someone whose receptors are more sensitive, the same hormonal signal may produce greater growth. This explains why two individuals of the same age, nutrition, and hormonal levels can have noticeable differences in their physical development. Another important point is the relationship between population genetics and penile length averages. Different ethnic groups may show slight variations due to long-term evolutionary and genetic adaptations. For example, average measurements in certain regions of Africa or South America may differ from those in East Asia or Europe. These differences do not imply superiority or deficiency. They reflect the genetic diversity of the human species. Just as skin color and facial features evolved in response to environment and genetics, so too did other physical traits. The variation serves an evolutionary purpose. It maintains genetic flexibility and adaptability within populations. The myth that external factors like specific foods, exercises, or manual techniques can significantly alter penile size is not supported by scientific evidence. Once puberty ends, the growth plates in the body close, and the genetic program for physical development has largely completed its course. The penis, being composed mostly of vascular tissue and smooth muscle, does not grow in the same way that skeletal muscles do. Exercise and nutrition can improve blood flow and health, but they cannot fundamentally change the genetic framework that sets size. Only medical interventions such as surgical procedures or traction devices can physically alter length, and even those are limited in their effectiveness because they work within the anatomical boundaries predetermined by genetics. It is also important to note that genetics influences not only length but also shape, girth, and curvature. These traits depend on how connective tissue, blood vessels, and the tunica albuginea, the fibrous covering of the erectile chambers, develop. Genetic variation in collagen composition or vascular density can result in small differences that make each individual anatomically unique. No two people have identical genetic expression patterns, which is why variation in penile structure is as natural as variation in facial features. Environmental influences during early development can have some effect, but they generally act by disrupting or supporting the genetic process rather than replacing it. For example, exposure to endocrine disrupting chemicals during pregnancy might slightly alter the normal hormonal environment of the fetus, which could influence development. Similarly, chronic illness or severe malnutrition in childhood might slow overall growth. However, these effects are usually minor compared to the genetic baseline. When health is restored, the body typically resumes growth within the limits set by its DNA. Modern genetics has begun to map out the specific loci or positions on chromosomes that may contribute to variations in penile development. Research into genes such as AR androgen receptor, SRD5A2, which converts testosterone to its more potent form, dihydrotestosterone, and HOXA13 involved in genital formation, shows that even small changes in these genes can lead to noticeable differences. However, most of these studies are still in early stages, and scientists caution that genetics is multifactorial. There is no single size gene. Rather, hundreds of genetic signals interact in complex ways, influenced by hormone levels, tissue response, and timing. Evolutionarily, penile size has not been strongly selected for survival. Human reproduction depends on many factors: emotional bonding, communication, fertility, not just anatomy. Therefore, natural selection did not narrow the range of penile lengths as tightly as it did for other vital organs. This relaxed evolutionary pressure explains why the variation remains wide. From a biological perspective, as long as the organ functions adequately for reproduction, size differences carry little evolutionary consequence. This also reinforces the understanding that individual variation is both natural and neutral. Scientific literature repeatedly emphasizes that normality is statistical, not absolute. When a doctor assesses whether a patient's penile size is normal, the comparison is not to an ideal, but to a range derived from large population data. For example, an erect length between roughly 10 and 16 centimeters, about 4 to 6.3 inches, encompasses the majority of healthy adult men. Being slightly below or above that range does not indicate abnormality unless accompanied by functional issues. What matters medically is whether the organ performs its intended functions: urination, erection, and reproduction effectively. The genetic aspect also shapes the psychological narrative surrounding size. Because physical traits are inherited, many cultural beliefs about masculinity and heredity become intertwined. Some individuals mistakenly associate penile size with strength, virility, or attractiveness, but these associations have no scientific basis. They are social constructs, not biological realities. Understanding the genetic foundation helps dispel these myths. It shifts the focus from comparison to comprehension, recognizing that variation is built into the human genome and does not equate to inferiority or superiority. In clinical practice, urologists often reassure patients who express concern about size by explaining the concept of genetic variation. Visual perception can also distort judgment when viewed from above. One's own body proportions can make the penis appear smaller than it is. Objective measurement under standardized conditions often reveals that most men fall well within the average range. Education about genetics and anatomy thus becomes a key component of psychological well-being. Ultimately, genetics is the master architect of the human body. The length, shape, and proportions of the penis, like the rest of our physical features, are encoded in the double helix of DNA that carries the instructions for life. From the earliest stages of embryonic growth to the hormonal surge of adolescence, these genetic instructions guide every step. No external shortcut can rewrite that blueprint. Appreciating this fact not only clarifies the science, but also encourages acceptance of natural diversity. The role of hormones, especially testosterone, in determining penile length and development is fundamental to human biology. Hormones act as chemical messengers that instruct the body when and how to grow, mature, and differentiate its tissues. Among these hormones, testosterone stands at the center of male sexual development, influencing not only the size and function of the penis, but also the overall physical and psychological traits that define male characteristics. Understanding this process requires exploring how hormonal signals operate from the earliest stages of fetal life through puberty, and how the body's response to these signals shapes the final outcome of penile size. It also involves recognizing that while hormones are powerful, their effects are time-bound and governed by genetic instructions that limit their influence beyond specific developmental windows. The process begins long before birth. During the early stages of pregnancy, all human embryos appear nearly identical, regardless of genetic sex. Around the 7th to 8th week of gestation, the genetic blueprint encoded in the Y chromosome triggers a cascade of hormonal changes. The SRY gene on the Y chromosome activates the formation of the testes in the developing embryo. These embryonic testes begin secreting testosterone, which acts on receptors in various tissues of the body to promote the development of male reproductive structures. At this point, the genital tubercle, a small mound of tissue present in both male and female embryos, responds to testosterone by elongating and differentiating into the penis. The process is highly dependent on the sensitivity of the androgen receptors in the developing tissues. If these receptors are highly responsive, the tissues grow and differentiate efficiently. If they are defective or less sensitive, even normal levels of testosterone may not produce typical development, which can result in anatomical differences. During this fetal stage, testosterone also influences the closure of the urethral folds, the formation of the scrotum, and the internal reproductive tract. Another crucial hormone derived from testosterone, called dihydrotestosterone (DHT), plays an even stronger role in masculinization. DHT is produced by the enzyme 5-alpha reductase, which converts testosterone into this more potent form. DHT binds to androgen receptors more effectively and is responsible for much of the external genital development. Any deficiency in 5-alpha reductase or insensitivity to DHT can lead to underdeveloped genitalia, confirming the central role of hormonal regulation in penile formation. The amount of testosterone or DHT present during these critical weeks essentially determines the initial size and structure of the penis before birth. After birth, hormonal levels drop significantly and remain low throughout childhood. This period of relative hormonal inactivity is known as the juvenile pause. During this time, the penis and other reproductive organs grow only in proportion to general body growth. It is not until puberty that hormonal activity surges again, initiating a second major phase of penile growth. C. The hypothalamus in the brain releases gonadotropin-releasing hormone, GnRH, which signals the pituitary gland to produce two key hormones, luteinizing hormone LH and follicle-stimulating hormone FSH. LH stimulates the testes to produce testosterone, while FSH supports the maturation of sperm-producing cells. The rise in testosterone levels acts on androgen receptors throughout the body, triggering the development of secondary sexual characteristics such as increased muscle mass, deepening of the voice, facial hair, and the final growth of the penis and scrotum. Puberty is the defining window during which the penis achieves its adult size. The lengthening and thickening that occur during this stage are directly correlated with testosterone levels and receptor sensitivity. Research has shown that boys who experience delayed or incomplete puberty due to hormonal deficiencies, such as hypogonadism, often have smaller penile dimensions unless treated with testosterone replacement therapy at the appropriate developmental time. Conversely, conditions that lead to excess androgen production can result in slightly accelerated or exaggerated genital growth. However, once puberty concludes and the hormonal surge stabilizes, the growth plates in the body, including those that influence genital tissues, close, and further enlargement becomes biologically unlikely. Testosterone thereafter maintains function rather than contributing to additional size. The exact mechanism by which testosterone stimulates penile growth involves a complex interaction between cellular proliferation and tissue differentiation. Testosterone binds to androgen receptors within the cells of the corpora cavernosa, the sponge-like erectile tissues of the penis. This binding triggers genetic activity within the nucleus, leading to the production of proteins that promote cell division and tissue expansion. Blood vessel development also increases to support the growing tissue. However, these processes depend on the developmental stage of the individual. In adults, the same hormonal signals do not have the same proliferative effect because the tissues have already matured and stabilized. This is why testosterone therapy in adult men may enhance libido and erectile function, but does not increase size beyond the genetically established limit. Hormonal balance is delicate, and both deficiency and excess can lead to complications. For example, insufficient testosterone production during puberty can lead to micropenis, a medical condition where the penis remains significantly below the normal size range. This condition can sometimes be treated with testosterone or DHT therapy if administered early, demonstrating that hormones can influence growth but only within certain developmental periods. On the other hand, excessive use of synthetic anabolic steroids, common among some athletes or bodybuilders, can disrupt the natural hormonal axis. The body senses high external testosterone levels and suppresses its own production, leading to shrinkage of the testes and potential hormonal imbalance that might impair erectile function. Thus, hormonal regulation must remain in harmony for optimal sexual development and health. Hormones also influence tissue elasticity, vascularity, and sensitivity factors that indirectly affect penile appearance and function. Testosterone promotes the health of the endothelium, the inner lining of blood vessels, ensuring adequate blood flow to the erectile tissues. This vascular health is essential for erectile quality, though not for anatomical length. Furthermore, testosterone maintains the smooth muscle mass within the penis, preventing atrophy that can occur in cases of long-term deficiency. This is why men with chronically low testosterone may experience a subtle reduction in penile fullness or elasticity, though not necessarily a change in bone measurable length. Restoring testosterone to normal physiological levels can reverse some of these functional changes, underscoring the hormone's role in maintaining structural integrity even after growth has ceased. The interplay between genetics and hormones cannot be separated. While genetics sets the framework for potential size, hormones determine how much of that potential is realized. Two individuals with similar genetic coding for penile length might end up with different outcomes if one experiences hormonal imbalance during development. For instance, conditions affecting the pituitary gland or hypothalamus can interrupt the hormonal signals that drive testosterone production. Similarly, mutations in the androgen receptor gene can make the tissues less responsive to the hormone, resulting in underdeveloped genitalia despite normal testosterone levels. This variability explains why hormonal health is critical not only for growth but also for overall reproductive function. Beyond physical development, testosterone influences aspects of behavior, mood, and confidence. These psychological effects contribute indirectly to perceptions of masculinity and sexual adequacy. A balanced hormonal environment during adolescence fosters both physiological and emotional maturity. Deficiencies can lead to reduced energy, low libido, or anxiety about sexual performance, which may further distort body image perceptions. In such cases, medical intervention with hormone therapy can restore normal functioning and improve self-esteem, but must be carefully monitored by professionals to avoid overcorrection. Environmental and lifestyle factors can also impact hormonal activity, though they do not override genetic programming. Chronic stress, obesity, poor diet, lack of sleep, and exposure to endocrine-disrupting chemicals such as phthalates or bisphenol A BPA can reduce natural testosterone production. When testosterone levels fall below optimal levels, the body may experience secondary effects such as reduced muscle mass, lower energy, and weaker erections. However, even if testosterone is restored to normal, these changes affect function rather than structure. The critical message remains that the window of anatomical growth closes after puberty, and hormonal balance afterwards serves maintenance, not enlargement. Scientific experiments in both humans and animals have shown how timing determines hormonal influence. When testosterone or DHT is administered during the appropriate developmental period, growth effects are evident. The same interventions at a later age yield negligible structural change. This demonstrates that the body's tissues have a period of plasticity during which hormones can induce growth, followed by a period of stability when the same signals no longer produce significant change. This biological law applies not only to the penis but to other body systems as well. Bones, muscles, and secondary sexual features all follow similar temporal rules governed by hormonal sensitivity. There is also a misconception that increasing testosterone beyond natural levels can enhance size or performance indefinitely. In reality, the body operates within homeostatic limits. Excess testosterone is often converted to estrogen through the enzyme aromatase, which can cause adverse effects like gynecomastia, enlarged breast tissue, or mood disturbances. Moreover, artificially high testosterone can reduce the natural production of gonadotropins, leading to testicular shrinkage and infertility. Medical specialists therefore emphasize the importance of maintaining testosterone within physiological ranges, focusing on restoring balance rather than achieving artificial enhancement. In adulthood, hormones continue to play a vital role in sexual health, but primarily in function and desire rather than anatomical growth. Testosterone supports nitric oxide production, a molecule critical for vasodilation and erection. Adequate hormonal levels ensure proper circulation and erectile response, reinforcing the understanding that performance depends more on hormonal and vascular health than on physical dimensions. Men who suffer from low testosterone may experience erectile dysfunction or decreased libido, conditions that are reversible through proper treatment but do not alter size. These functional benefits often explain why some people confuse hormonal therapy with growth enhancement, when in fact the effect is on physiological responsiveness, not anatomical expansion. In summary, hormones, and particularly testosterone, serve as the biological engine that drives male sexual differentiation, development, and maintenance. From fetal life through puberty, their influence shapes the size and structure of the penis, but only within genetic boundaries and specific developmental periods. Beyond those stages, hormones preserve function and vitality rather than structural growth. Their impact on penile length is therefore both powerful and limited powerful in defining the developmental process, but limited by time and genetic programming that dictate and how far that process can go. The discussion surrounding penile enlargement has been filled with myths, exaggerations, and misconceptions for decades, often driven by cultural expectations, marketing tactics, and misinformation rather than science. The reality, as confirmed by medical research and neurological studies, is that most advertised methods of penile enlargement simply do not work or lack credible scientific evidence to support their claims. When people search for ways to increase penile length, they encounter an overwhelming number of pills, pumps, exercises, oils, and surgeries, each claiming miraculous results. Yet, scientific investigation into these methods shows that very few have any measurable or lasting effect, and some can even cause harm. The myth versus reality gap in this subject arises from the contrast between public desire and biological limitation. Human anatomy follows fixed developmental rules, and once puberty concludes, the body's genetic program determines the size and structure of its organs, including the penis. No external method can override this genetic and hormonal blueprint. Most popular claims begin with over-the-counter pills and supplements advertised as natural male enhancers. These products often contain herbs such as ginseng, ginkgo biloba, maca root, tribulus terrestris, or yohimbine. While some of these ingredients may have mild effects on blood flow, mood, or energy, none of them have been proven to increase penile length or girth permanently. Clinical trials have repeatedly failed to show measurable growth after consistent use. The physiological reason is simple. The penis is not a muscle that can grow larger through nutrient supplementation or exercise. It is composed of vascular and connective tissue that fills with blood during arousal, but does not expand through hypertrophy like skeletal muscle. Herbal supplements may improve circulation or libido, but they cannot create new tissue. Moreover, some of these unregulated products are contaminated with synthetic drugs or harmful chemicals that can damage the liver or cardiovascular system. The false hope they create often leads individuals to waste money and risk their health without any true benefit. Mechanical devices such as vacuum pumps are another category that often appears in discussions of enlargement. These pumps work by creating a vacuum around the penis, drawing blood into the erectile chambers and temporarily increasing size due to engorgement. While this can produce a short-lived swelling effect, the results vanish after the vacuum is released. Medical professionals do use similar pumps as therapy for erectile dysfunction to help men achieve erections, but not for permanent enlargement. Overuse or misuse of vacuum pumps can cause bruising, pain, or damage to the blood vessels. Scientific reviews have confirmed that there is no long-term growth effect from these devices when used outside of medical supervision. Their only legitimate ethical purpose is to assist with temporary erectile performance, not to change anatomy. Another widely circulated method involves stretching exercises, commonly called jelqing. The practice originated from anecdotal traditions and spread across online forums, where individuals claim that repetitive manual stretching of the penis can stimulate tissue growth. Scientifically, however, there is no controlled evidence to support these claims. The tissues of the penis are elastic, but have structural limits defined by collagen fibers and smooth muscle composition. Excessive stretching can injure these tissues, causing microtears, scarring, or the formation of plaques that lead to curvature or dysfunction. In some cases, improper stretching techniques have been linked to Peyronie's disease, a condition where scar tissue causes painful and distorted erections. The human penis does not respond to mechanical stress in the same way as muscle or skin tissue used in other types of body modification. Its structure is designed for controlled expansion during erection, not continuous external stretching. Therefore, any claim that exercises can permanently lengthen it ignores basic anatomical science. Some individuals turn to traction devices, which are more sophisticated than manual stretching. These devices apply a consistent, gentle pulling force over extended periods, theoretically stimulating cellular adaptation known as mechanotransduction. In medicine, traction therapy has been used in certain conditions like post-surgical penile rehabilitation or correction of curvature due to Peyronie's disease. Some studies have reported minor increases in length, usually in the range of 0.5 to 2 centimeters, after many months of continuous supervised use. However, these results are limited, vary widely among individuals, and require commitment to daily usage for hours at a time under medical supervision. Traction devices are therefore considered a clinical tool rather than a practical enlargement solution. They are not risk-free. Discomfort, numbness, and tissue irritation can occur if used incorrectly. Urologists emphasize that while traction therapy might produce modest improvements, it does not transform anatomy beyond the body's natural elasticity and should never be used without guidance. The most invasive options are surgical procedures, which are often portrayed as guaranteed solutions but come with significant risks. Surgery can be divided into two main categories: lengthening and thickening procedures. Lengthening surgeries typically involve cutting the suspensory ligament that attaches the penis to the pubic bone. This allows more of the internal portion of the penis to extend outward, giving the appearance of increased length. However, this does not increase the actual size of the penis or improve function. It merely changes the visible angle of the organ. Postoperative complications are common and include scarring, instability, and loss of erection angle. Some men experience shortening instead of lengthening due to scar contraction. The other type of surgery, girth enhancement, involves injecting fat, silicone, or other fillers under the skin. These methods can create an uneven appearance, lumps, or infection. Even when successful, the effects are often temporary as the body reabsorbs the injected material over time. Medical experts generally advise against cosmetic penile surgery unless for reconstructive purposes after trauma or congenital defects. The psychological element behind the popularity of enlargement myths is as important as the biological one. Many men who seek these methods are not suffering from a physical problem, but from a psychological one known as penile dysmorphophobia, a distorted self-perception of size. Studies have shown that most men who believe their penis is too small actually fall within the normal range when measured clinically. The widespread exposure to unrealistic images in pornography and media contributes to feelings of inadequacy and comparison. This mental dissatisfaction drives the market for unproven products. Unfortunately, companies exploit these insecurities with aggressive marketing, often presenting fabricated testimonials and manipulated images to convince buyers that permanent growth is achievable. The result is a cycle of disappointment and further anxiety when expectations are not met. Medical literature consistently emphasizes that the true goal of any legitimate intervention should be to improve confidence, function, or health, not to chase unrealistic physical ideals. Urologists and psychologists often work together to address body image concerns by providing education about normal anatomical variation. Understanding that penile size is largely genetic and that average dimensions are much smaller than popular myths suggest can alleviate unnecessary stress. In clinical practice, reassurance and counseling often prove more effective than any mechanical or surgical method in improving satisfaction. This demonstrates that the perception of inadequacy is more a psychological challenge than a physical one. The rise of the internet has amplified the spread of misinformation. Social media influencers, unlicensed clinics, and anonymous websites frequently advertise miracle cures, showing before and after images that are digitally altered or based on temporary swelling effects. Many of these products escape regulatory oversight, especially in countries with less stringent medical enforcement. The U.S. Food and Drug Administration, FDA, and similar agencies around the world have issued warnings against numerous male enhancement supplements found to contain hidden pharmaceutical ingredients such as sildenafil, the active component in Viagra, or other unapproved substances. These adulterations can cause dangerous side effects like sudden drops in blood pressure or cardiac complications when taken unknowingly, especially in individuals using other medications. This deceptive e-market thrives on the hope that science has not yet revealed a secret method. But in truth, no legitimate scientific breakthrough supports permanent enlargement through any pill or device. Scientific studies exploring tissue expansion in reconstructive medicine, such as skin or bone stretching, show that such techniques require precise control, sterile environments, and long healing periods. Applying similar concepts to the penis outside of medical supervision is unsafe and unrealistic. The human penis does not possess the regenerative capacity of skin flaps or bone tissue used in reconstructive surgery. Its structure consists of delicate vascular spaces that must remain intact for normal function. Repeated trauma, compression, or irregular stretching can permanently impair erectile ability. Some men who attempt self-experimentation report chronic pain, deformity, or impotence. These irreversible complications highlight the dangers of pursuing enlargement through unscientific or self-administered methods. The persistence of these myths also reveals how deeply masculinity is associated with size in many cultures. Anthropologists and sociologists note that throughout history, societies have used the male sexual organ as a symbol of power, dominance, or fertility. Modern marketing exploits these deep-seated associations, creating an illusion that greater size equals greater satisfaction or desirability. Yet, scientific studies on sexual satisfaction among couples consistently find that emotional intimacy, communication, and overall relationship quality outweigh anatomical dimensions by a significant margin. In fact, surveys reveal that the vast majority of women consider average size perfectly adequate and prioritize emotional connection and technique over size. These findings dismantle the cultural myth that physical dimensions are the key determinant of pleasure or confidence. From a medical perspective, the only scientifically proven ways to influence penile size involve hormonal or surgical intervention under specific conditions, such as hormone deficiencies during puberty or reconstructive surgery after trauma. Even in these cases, the goal is to restore normal development or function, not to exceed natural limits. Research continues in areas such as tissue engineering and stem cell therapy, but these are still experimental and not approved for clinical use in enlargement. Any product or procedure claiming otherwise should be regarded with skepticism until validated through rigorous peer-reviewed studies. The ethical responsibility of the medical community is to protect patients from exploitation and harm, emphasizing evidence-based medicine over commercial promises. Ultimately, the reality is that no supplement, exercise, or device can safely and permanently increase penile size beyond the limits established by genetics and hormonal development. The human body is not infinitely modifiable, and the penis, as a complex vascular organ, cannot be expanded like muscle or cartilage. The emphasis, therefore, should shift from enlargement to understanding, from chasing myths to accepting the biology of natural variation. Science does not support the fantasy of effortless enhancement, but it does provide a deeper truth that confidence, health, and satisfaction come not from altering anatomy, but from respecting and caring for it. Medically approved treatments for penile enlargement are a topic that blends science, surgery, tissue, and are less prone to resorption. However, even these methods require meticulous handling, as infection, irregular shape, or decreased sensation can occur if healing is poor. A more modern and less invasive development is penile traction therapy, a non-surgical but clinically monitored technique. The idea is based on tissue expansion principles, where gentle, consistent stretching over time stimulates cellular growth and remodeling. Traction devices are designed to exert a steady pulling force, and several studies have reported small but measurable increases in length after months of daily use. Most research shows gains of 1 to 2 centimeters after 3 to 6 months of consistent application. The mechanism is biological mechanical tension promotes the proliferation of fibroblasts and collagen deposition, which can gradually elongate the tissue. However, this process is slow and demands patience and proper device use to avoid bruising or injury. Traction therapy is sometimes prescribed postoperatively to maintain results after ligament release surgery, preventing the ligament from reattaching too high during healing. Urologists generally consider this the safest scientifically validated non-surgical method, but only under supervision and with medically approved equipment. Another area that has drawn scientific interest is hormonal therapy. Because testosterone and growth factors play roles in genital development during puberty, researchers have explored whether hormonal manipulation in adults could extend that effect. In men with clinically low testosterone, replacement therapy can improve libido, energy, and erectile function, but it does not normally increase penile size once puberty has ended. The growth plates and androgen receptors involved in penile development are no longer responsive at adult levels. Therefore, hormonal therapy is only justified for patients with a deficiency, not for enlargement purposes in healthy men. Still, correcting hormonal imbalance can enhance function, confidence, and perceived size due to better blood flow and firmness during erection, which indirectly improves satisfaction. Beyond traditional hormones, regenerative medicine has introduced techniques like platelet-rich plasma PRP injections and stem cell therapy. PRP involves drawing a patient's own blood, concentrating the platelets, and injecting them into the penile tissue. Platelets contain growth factors that may enhance vascularity and nerve sensitivity. Some small studies suggest that PRP could improve erectile quality, but the evidence for actual size increase remains minimal. Similarly, stem cell research is investigating the ability of regenerative cells to restore or rejuvenate erectile tissue, particularly in cases of damage or Peyronie's disease. While promising for function recovery, these therapies are still in early experimental stages, and no reputable medical board currently endorses them as enlargement treatments. Another therapeutic category, though not directly for enlargement, concerns vacuum erection devices VEDs. These devices create negative pressure around the penis, drawing blood into the corpora cavernosa and causing temporary engorgement. Regular and controlled use may enhance tissue oxygenation and maintain elasticity, which can slightly affect length over time, especially in men recovering from prostate surgery or conditions that reduce blood flow. Clinical reviews show modest results and recommend VEDs mainly for functional rehabilitation rather than cosmetic enhancement. When used in combination with traction therapy, some doctors report improved outcomes due to better circulation supporting tissue adaptation. It's important to note that most medical interventions for penile enlargement are accompanied by extensive psychological evaluation and counseling. Many men who request such procedures have a distorted perception of their size, often influenced by unrealistic media representations or cultural myths. Studies consistently reveal that most men who believe their penis is small are within the normal range. Addressing body image concerns through therapy often resolves dissatisfaction more safely and effectively than surgery. This psychological component is an integral part of the medically approved approach because satisfaction after surgery is closely linked to expectations and mental well-being. A man who understands the limitations of treatment tends to be more satisfied with modest results than one expecting dramatic change. Medical ethics also play a significant role in defining what counts as an approved procedure. Professional urological associations emphasize that the goal should be patient health, not exploitation of insecurities. Clinics promoting instant or exaggerated outcomes are often outside ethical practice. Approved methods must undergo peer-reviewed trials, long-term follow-up, and risk assessment. Surgeons performing such operations are expected to inform patients about potential complications, realistic results, and alternative non-surgical approaches. Informed consent is mandatory. The focus remains on safety and scientific adaptation programs that focus on improving blood flow, erectile endurance, and neuromuscular coordination. These do not alter length directly, but enhance overall performance, which many patients ultimately find more satisfying than size change alone. Improved vascular health through aerobic exercise, balanced diet, and smoking cessation has a measurable effect on penile rigidity, making the penis appear fuller and healthier. Physicians often redirect patients towards such holistic programs because the improvement in function and confidence often eliminates the original concern about size. While technology and medicine continue to evolve, no universally effective or risk-free enlargement method exists today. The treatments that are considered approved all share certain traits. They are medically supervised, supported by clinical evidence, and performed for legitimate reasons. Each carries its own level of benefit and risk, and none guarantee dramatic transformation. The success of any intervention depends as much on patient education, expectations, and emotional stability as on the surgical or therapeutic technique itself. For this reason, most reputable urologists recommend that men first consult with a qualified professional, discuss goals openly, and pursue only those treatments that have undergone rigorous testing and peer-reviewed validation. Ultimately, the science behind medically approved treatments for penile enlargement reflects a careful balance between biological reality and human desire. The medical field acknowledges that tissue can be altered to some extent, but it also respects the natural limits imposed by genetics, physiology, and safety. By focusing on controlled, evidence-based methods like traction therapy, selective surgery, and hormonal correction where necessary, urologists aim not just to modify anatomy, but to restore confidence, function, and psychological well-being. This scientific and ethical approach defines what truly counts as a medically approved path in the complex and often misunderstood world of male enhancement. The psychological aspect of penile size perception is one of the most significant and complex dimensions of male sexual health. Although medical science can measure the physical length or girth of the penis with objective tools, the way men interpret those measurements is highly subjective and influenced by countless psychological, cultural, and emotional factors. For many men, the question of size is not only a biological issue, but deeply tied to their sense of identity, masculinity, confidence, and self-worth. Modern urology and psychology both agree that understanding these mental and emotional layers is essential before any medical treatment is considered, because dissatisfaction with size often originates more from perception than from reality. Researchers have found that a large number of men who seek enlargement procedures are within the medically normal range, yet they believe themselves to be inadequate. UAT, a condition known as penile dysmorphic disorder or small penis anxiety. From an early age, social conditioning begins to shape how men think about their bodies. Boys grow up hearing jokes, comments, or cultural myths that equate masculinity and sexual prowess with genital size. This connection is reinforced by peer conversations, locker room comparisons, and later exposure to pornography, where exaggerated representations of male anatomy create unrealistic standards. The subconscious message that develops is that a larger penis equals greater sexual success, desirability, and dominance. As men internalize these beliefs, they begin to evaluate their own worth through this narrow lens. This process fosters body image anxiety, similar to how some women feel pressured to maintain certain body proportions or beauty ideals. The difference is that men rarely discuss such insecurities openly, which can make them more psychologically damaging over time. Clinical research shows that the majority of men who feel dissatisfied with their penile size actually fall within the average range. Medical studies have established that the average erect penis measures about 13 centimeters in length, yet men often assume that anything below 15 or 16 is small. This misconception is amplified by the distorted images seen in media. The cognitive distortion that follows is known as size overestimation bias, where a person's mind exaggerates the importance of one physical attribute beyond its real value. This bias often creates a cycle of comparison and self-doubt. The man becomes hyper-aware of his size, avoids situations where he might feel exposed, and may even withdraw from relationships out of fear of judgment. Such behavior patterns are not caused by physical inadequacy, but by persistent negative thoughts that reshape self-image. Psychologists who work with men experiencing such insecurities emphasize that sexual satisfaction and performance are far more related to confidence, communication, and emotional connection than to anatomical dimensions. When a man believes he is inadequate, that belief alone can generate performance anxiety, which in turn can cause erectile dysfunction or premature ejaculation. These functional issues reinforce the initial insecurity, creating a psychological feedback loop. Breaking this loop requires cognitive restructuring, where the individual learns to challenge distorted beliefs and focus on aspects of intimacy that truly matter. Therapy techniques like cognitive behavioral therapy (CBT) have been successful in helping men develop healthier body perceptions by teaching them to identify unrealistic comparisons and internalized cultural pressures. Another key psychological element involves the partner's perspective. Studies show that women and sexual partners rarely prioritize penile size as much as men assume they do. Surveys indicate that most women consider emotional intimacy, foreplay, and mutual understanding far more significant to sexual satisfaction than physical dimensions. However, men who suffer from size anxiety often dismiss such reassurances, believing their partner is being polite or sympathetic. This mistrust stems from deep-seated self-esteem issues that require psychological intervention rather than medical alteration. When therapy helps men genuinely internalize that their worth and desirability are not dependent on size, both their confidence and their sexual experiences improve dramatically. In some cases, dissatisfaction is linked to perfectionism or obsessive-compulsive tendencies, where the individual fixates on minor physical details. This form of body dysmorphic disorder (BDD) can lead men to pursue multiple, unnecessary, and risky medical procedures in the hope of achieving an imagined ideal. Unfortunately, surgery or other physical intervention seldom resolve psychological dissatisfaction. After each procedure, the patient may find new flaws or feel that the improvement was not enough, perpetuating emotional distress. Mental health professionals therefore insist that psychological evaluation and counseling are mandatory before any surgical consideration. Addressing the emotional roots of dissatisfaction not only protects the patient's mental health, but also reduces regret and complications later. Cultural expectations also play a major role in shaping how men perceive their bodies. In some societies, manhood is symbolically linked to virility and strength, which are metaphorically represented by genital size. Men raised in such environments may feel constant pressure to live up to these ideals. Media and advertising further commercialize this anxiety by promoting products that claim to increase size or enhance performance. Even though scientific evidence for such products is absent, the marketing appeals to emotional insecurity, promising confidence and masculinity in a bottle. Psychologists note that when individuals base their self-image on these external reinforcements, their confidence remains fragile. True self-assurance, in contrast, arises from internal validation, accepting one's body as normal and functional, rather than as a symbol to impress others. Relationship dynamics are also affected by size-related insecurities. Men who feel inadequate may avoid physical intimacy or overcompensate by becoming overly focused on performance. This emotional tension can create distance with their partners, who may misinterpret the withdrawal as lack of interest or affection. Open communication often resolves this gap, but it requires vulnerability and honesty, traits that societal conditioning sometimes discourages in men. Counseling or sex therapy can provide a safe space to rebuild intimacy through dialogue and shared understanding. When both partners acknowledge that mutual pleasure depends more on emotional connection and technique than on anatomy, the relationship strengthens and anxiety diminishes. The physiological link between the mind and body further demonstrates why psychological health is central to sexual wellness. Stress and anxiety trigger the release of cortisol and adrenaline, which constrict blood vessels and inhibit erectile function. A man who feels insecure about his size may therefore experience real physiological consequences due to mental stress. The body reacts to psychological signals as though facing a threat, reducing blood flow and sensitivity. Over time, this leads to avoidance patterns and reinforcement of negative beliefs. By contrast, when a person feels confident and relaxed, parasympathetic nervous activity enhances circulation and arousal, creating a positive feedback loop between mind and body. In this sense, psychological well-being directly translates into physical performance. Therapists often use mindfulness-based techniques to help men reconnect with their bodies in non-judgmental ways. Mindfulness trains awareness of the present moment without labeling sensations as good or bad. Men who practice this approach learn to experience sexual activity as a full-body interaction rather than a performance test. Such awareness reduces anxiety and allows genuine pleasure to emerge. Another therapeutic method is body-positive coaching, where men are guided to appreciate the functionality of their bodies, the ability to give and receive pleasure rather than obsessing over measurements. Over time, these mental shifts can transform not only personal confidence but also relationship satisfaction. Another important psychological dimension is the role of comparison. In the digital era, men are constantly exposed to idealized or edited images through pornography and social media. These representations do not reflect average bodies but exaggerated ones selected for visual impact. The brain, however, processes them as if they were real-world norms. This leads to the internalization of false standards, where an average body feels insufficient. Researchers have found that frequent pornography consumption correlates with greater body dissatisfaction among men, even though it has little to do with real sexual performance. Reducing exposure to such media and focusing on real, emotionally connected experiences can therefore restore a healthier sense of normalcy. Social isolation can also magnify insecurity. Men who struggle with size-related anxiety may avoid medical checkups, fearing judgment from healthcare professionals. They might also refrain from forming close friendships or relationships, reinforcing loneliness and shame. In clinical settings, once these men realize that their size is medically normal and that their fears are common, the relief itself becomes therapeutic. Empathy and education from healthcare providers can dismantle the stigma and encourage open discussion. The process of normalizing the topic allows men to regain control over their body image and recognize that satisfaction and confidence are psychological achievements, not anatomical ones. The in Fluence of early experiences also plays a subtle role. For instance, men who were teased or humiliated about their body during adolescence often carry those wounds into adulthood. Even casual remarks can embed themselves deeply in the psyche, shaping lifelong self-perceptions. Therapy can help identify and neutralize these formative experiences through emotional reprocessing techniques. By confronting and releasing those old associations, men can reframe their identity based on current realities rather than past judgments. This process restores self-compassion and breaks the mental link between shame and physical appearance. In the broader view of sexual psychology, size anxiety represents just one example of how cultural myths distort natural diversity. Human anatomy varies widely, and this variation has no correlation with emotional intelligence, empathy, or ability to connect with a partner. Urologists and psychologists therefore advocate for comprehensive education about sexual health that includes discussions of normal variation and the psychological harm caused by unrealistic expectations. When young men learn early that their worth is not measured by size, they are less likely to develop the insecurities that drive adult distress. Such education forms the foundation of long-term mental and relational well-being. In clinical practice, addressing the psychological aspect often brings better outcomes than any physical procedure. Once men understand that their concern is more about self-image than anatomy, the desire for surgery or enhancement usually diminishes. Instead, they focus on improving fitness, communication skills, and emotional intimacy, all of which contribute more to satisfaction. Medical professionals now recognize that patient counseling and psychological support are indispensable components of male sexual health care. By treating the mind alongside the body, healthcare achieves what physical interventions alone cannot: genuine, lasting confidence grounded in self-acceptance and emotional balance. What scientists know but rarely emphasize about penile health and perceived size involves the deeper physiological truth that function, circulation, and overall wellness matter far more than anatomical measurements. When discussing sexual performance and satisfaction, urologists and endocrinologists repeatedly highlight that the penis is not a static structure, but a highly vascular organ, dependent on healthy blood flow, hormonal balance, and psychological stability. Yet, this message often receives little attention in popular discussions, which focus narrowly on enlargement. The reality is that the same factors that promote cardiovascular and metabolic health, exercise, diet, sleep, stress control, also optimize erectile quality, sensitivity, and sexual confidence. Scientists understand that when blood vessels, nerves, and hormonal signals operate efficiently, the penis functions at its full physiological capacity, which can make it appear larger and more responsive without any change in structural length. This aspect of human biology, though well established in research, is often overlooked in favor of superficial quick fixes that ignore the body's systemic interconnectedness. The penis is composed mainly of erectile tissue, corpora cavernosa, and a corpus spongiosum containing a dense network of arteries, veins, and smooth muscle fibers. During arousal, nitric oxide released by nerve endings causes these muscles to relax, allowing blood to flow rapidly into the spaces, creating pressure and rigidity. Any factor that interferes with vascular dilation or nerve signaling can reduce erection quality, leading to the perception of reduced size. Medical studies show that men with poor cardiovascular health frequently report weaker erections, and this is not because of changes in anatomy, but due to impaired circulation. Atherosclerosis, high blood pressure, diabetes, and smoking are among the leading causes of erectile dysfunction because they damage the endothelium, the thin inner lining of blood vessels, responsible for producing nitric oxide. When this chemical signaling is disrupted, blood flow to the penis diminishes and erections become softer or shorter-lived. Thus, what scientists know but seldom publicize is that penile function serves as an early indicator of overall vascular health. A man's ability to achieve a strong erection is, in many ways, a reflection of his heart and arterial system's condition. Exercise, particularly aerobic and resistance training, has been shown to significantly enhance erectile function by improving endothelial health and increasing blood vessel flexibility. Regular physical activity reduces insulin resistance, lowers blood pressure, and enhances testosterone levels, all of which contribute to better sexual performance. Research from the American Urological Association and other bodies reveals that men who engage in consistent exercise have higher testosterone levels and more frequent spontaneous erections. This is not only a matter of hormone production, but also a result of optimized blood flow and vascular responsiveness. In practical terms, an erect penis that fills completely with blood appears larger and firmer, even though no anatomical growth has occurred. This observation underlies a subtle but vital truth: enhancing the body's circulatory efficiency can yield visible and functional improvements that far outweigh the temporary or risky results of mechanical or pharmaceutical enlargement methods. Diet plays a similarly critical role. Scientists have identified strong links between nutritional patterns and sexual health, with Mediterranean-style diets rich in fruits, vegetables, whole grains, healthy fats, and lean proteins associated with lower rates of erectile dysfunction. Foods high in antioxidants and polyphenols, such as berries, dark chocolate, olive oil, and green leafy vegetables, help reduce oxidative stress and inflammation, preserving vascular elasticity. L-arginine, an amino acid found in nuts, fish, and poultry, serves as a precursor to nitric oxide synthesis, directly supporting the biochemical pathway of erection. Conversely, diets heavy in processed sugars, trans fats, and refined carbohydrates contribute to insulin resistance and arterial stiffness, both of which impair circulation. When men adopt healthier eating habits, they not only improve heart and brain function, but also optimize penile vascular performance. Scientists are aware of these connections, but often find that patients remain focused on size enhancement rather than the broader principle of systemic health that sustains sexual vitality. Hormonal balance, especially concerning testosterone, is another crucial factor that scientists acknowledge, yet the public tends to misinterpret. Testosterone affects libido, energy, mood, and muscle mass, but its relationship with penile size is limited to developmental stages. After puberty, testosterone's role becomes functional rather than structural. It enhances nerve sensitivity and vascular reactivity, enabling better erectile response. Men with chronically low testosterone may experience decreased firmness and reduced spontaneous erections, which can make the penis appear smaller or less active. In reality, the structure remains the same. It is the diminished blood flow and reduced tissue engorgement that create the illusion of shrinkage. Restoring normal testosterone levels through medical supervision, lifestyle changes, or treatment of underlying endocrine disorders can therefore revive erectile fullness and perceived size. Scientists are cautious about emphasizing this aspect because commercial misuse of testosterone supplements has become widespread, often without proper diagnosis or monitoring. Yet in controlled, clinically indicated cases, hormonal optimization greatly enhances function and confidence. Sleep, another underestimated element, directly affects both hormonal regulation and vascular performance. During deep sleep, particularly REM cycles, men experience spontaneous nocturnal erections driven by surges in testosterone and parasympathetic nervous activity. These nightly erections serve a physiological purpose. They oxygenate penile tissue, maintain elasticity, and prevent fibrosis of the smooth muscle. Chronic sleep deprivation disrupts these cycles, leading to hormonal imbalance and reduced tissue health. Research consistently shows that men who sleep less than 6 hours a night have significantly lower testosterone and higher rates of erectile dysfunction. Proper rest, therefore, acts as a natural maintenance mechanism for penile health, ensuring that the tissue remains responsive and flexible. Scientists understand this intricate connection, but find that public discussions rarely address how sleep quality contributes to sexual well-being. overshadowed by fascination with size-oriented quick fixes. Stress management and mental health are equally vital in maintaining optimal penile function. Stress activates the sympathetic nervous system, releasing cortisol and adrenaline hormones that constrict blood vessels and divert circulation away from the genitals. Chronic anxiety or depression exacerbates these effects, suppressing libido and impairing erection. Moreover, psychological stress can make men hyper-aware of minor performance variations, creating a self-fulfilling cycle of anxiety-induced dysfunction. Mindfulness practices, meditation, deep breathing, and therapy reduce cortisol levels and restore parasympathetic dominance, which supports relaxation and blood flow. Studies have shown that mindfulness-based sexual therapy can improve erectile function and satisfaction by helping men focus on sensation rather than self-evaluation. Scientists know that emotional regulation is a biological necessity for sexual function, but it rarely features in public discourse about male enhancement, where focus remains on external modification instead of internal equilibrium. Another scientific truth that receives little public attention is the impact of vascular elasticity and nerve sensitivity on perceived size and pleasure. Over time, lifestyle factors such as smoking, alcohol consumption, and sedentary habits reduce tissue oxygenation and nerve conductivity. The fine sensory nerves in the glans penis and surrounding areas become less responsive, diminishing stimulation. Simultaneously, microvascular stiffness limits full engorgement, so the penis may not achieve its maximum potential length or firmness during erection. Quitting smoking and limiting alcohol can reverse many of these effects, restoring natural function. The body's capacity for repair through angiogenesis, the growth of new blood vessels, means that even moderate lifestyle improvements yield measurable benefits. Scientists recognize that these physiological adjustments do not change genetic length, but they enhance function to a level that patients perceive as fuller, stronger, and more satisfying. Hydration and tissue health also play subtle yet important roles. Dehydration decreases blood volume and vascular pressure, which can affect the quality of erections. Adequate water intake supports cellular metabolism and maintains the viscosity of blood, ensuring efficient oxygen delivery to erectile tissue. Similarly, regular stretching and mobility exercises for the pelvic floor muscles, especially targeting the pubococcygeus and bulbocavernosus muscles, improve erection rigidity by strengthening the structures responsible for blood retention during arousal. Pelvic floor training, often prescribed in physiotherapy, enhances control, endurance, and the ability to maintain erection without medication. These exercises also contribute to the perception of increased size because a firmer erection naturally appears larger. This again demonstrates the principle that function dictates perception, a fact that scientists acknowledge but that popular culture tends to overlook. Temperature regulation and body composition further influence the visual appearance of the penis. Excess adipose tissue in the pubic region can conceal part of the shaft, making the penis appear shorter even though the underlying structure remains unchanged. Weight loss through diet and exercise can reveal this hidden portion, effectively increasing visible length. Urologists often note that losing just 10 kilograms can uncover up to a centimeter of the buried shaft. Despite being a simple and scientifically grounded fact, this relationship between body fat and perceived size is rarely highlighted in mainstream discussions, which instead promote unrealistic or invasive interventions. Scientists understand that maintaining lean body mass not only improves metabolic health, but also enhances confidence through tangible visual improvement. An additional point often unspoken outside medical literature is the concept of vascular training through regular sexual activity or erections. The penis, like other muscles and organs, benefits from periodic blood flow and oxygenation. Long periods of abstinence or erectile inactivity can reduce elasticity and responsiveness. Regular stimulation, whether through partnered activity or natural nocturnal erections, maintains tissue health and prevents atrophy. This principle is well documented in physiology, where use-dependent mechanisms govern organ vitality. The use it or lose it concept applies literally to erectile tissue, yet it is seldom discussed publicly due to cultural taboos. Scientists, however, consider it a cornerstone of maintaining lifelong function. Another factor that scientists know but tend not to emphasize publicly is the role of overall inflammation and metabolic syndrome in sexual health. Chronic low-grade inflammation caused by obesity, poor diet, or infection affects endothelial cells, impairing nitric oxide release. Over time, this systemic inflammation damages small arteries, including those in the penis, which are often the first to show symptoms because they are narrower than coronary vessels. This is why erectile dysfunction can precede heart disease by several years, a phenomenon known as the canary in the coal mine effect. Recognizing early vascular issues through sexual symptoms can therefore save lives by prompting lifestyle changes or medical intervention before more serious cardiovascular events occur. This knowledge reinforces the idea that penile health is not isolated but integrally linked to overall wellness, a fact that scientists highlight in conferences but which mainstream discussions often ignore. In addition, there is the subtle but powerful influence of perception and self-confidence. Psychological studies show that men who feel physically fit and in control of their health report greater satisfaction with their size, regardless of objective measurement. Confidence alters the brain's interpretation of sensory input, amplifying pleasure and self-assurance. Neuroc. Chemical factors such as dopamine and oxytocin released during positive sexual experiences further reinforce this confidence loop. Scientists understand that the mind's perception of the body can influence physiological outcomes, a phenomenon observed in placebo studies and psychoneuroendocrinology. A confident mindset therefore enhances performance, which in turn enhances satisfaction, closing the circle between psychology and physiology. Ultimately, the scientific truth that often remains unspoken is that penile size, function, and satisfaction are less about isolated anatomy and more about integrated body systems. The vascular, endocrine, and nervous systems operate in harmony to produce optimal performance, and this harmony depends on lifestyle, emotional health, and internal balance. When the body's foundation circulation, hormones, nutrition, rest, and mental clarity strong, the penis performs to its natural potential, achieving fullness, sensitivity, and longevity. Scientists understand this holistic reality, but often refrain from emphasizing it publicly, perhaps because it requires sustained effort rather than quick results. Yet this understanding offers the most genuine path to improvement when a man nurtures his entire body and mind. The results extend far beyond what any external enlargement could provide. In conclusion, the truth about penile length and enhancement is far more scientific and psychological than commercial myths would have us believe. Across all 6 key points, one unshakable fact stands out: there is no miracle, no secret formula, and no shortcut to changing what nature has designed. Genetics largely defines size, hormones shape development, and most so-called enlargement methods lack credible evidence. The few medical options that exist offer limited results and must always be guided by a qualified urologist. Yet perhaps the most powerful discovery in this entire discussion is not biological but mental. Confidence, self-acceptance, emotional connection, and physical health together determine a man's satisfaction and his partner's experience far more than measurements ever could. Science quietly reminds us that function, blood flow, and psychological wellness create true sexual fulfillment. The message to every man, therefore, is simple: focus on overall health, balance your mind and body, trust medical facts over marketing claims, and remember that worth is never measured in inches, but in integrity, kindness, and self-respect. Thank you for listening with an open mind. May this knowledge empower you to make choices based on truth and confidence, not comparison or fear. Stay healthy, stay informed, and may you always have the courage to trust science over myths. Good luck, and thank you for your time.